her husband. Now, we want to check in with Nurse Alice Benjamin right now to help get us up to speed about what the president is going through this morning. And Nurse Alice, thank you so much for joining us.
Hi, thank you for having me. Good morning, everyone.
Good morning. Oh, yesterday, we learned that the president is not on supplemental oxygen, but the medical staff, they've elected to initiate remdesivir therapy at Walter Reed. So what can you tell us about this therapy?
So what we know about remdesivir is that it's typically reserved for people who are hospitalized and with severe complications and symptoms from COVID-19. It's an expensive drug. There is a shortage of it. But obviously, this is the president, so he's going to be afforded every single intervention that there is. So he's getting remdesivir. Hopefully, he's doing well with that. The fact that he doesn't need oxygen is a good indication that he's managing the disease process thus far.
And we're learning that several more people around the president have tested positive as well, and that contact tracing is underway. Now, how far back will they have to trace, and how difficult do you think it'll be to track down the source of the president's infection?
Well, so we're talking about the president, someone who's all over the place, not wearing masks, who's been on the campaign trail. That's going to be quite a task to do. Now, the CDC does have a health department checklist that does set guidelines out for contact tracing, but it's up to each state individually. Now, because this is the president, I anticipate that they're going to go at least 30 to 60 days from his exposure, just because we're going to want to see not only when was he exposed, but also who could he have possibly exposed as well. I mean, you're seeing him at this at the ceremony, and I have to say I'm very disappointed that the White House approved this type of event, because this is endangerment. We're putting people's lives here in danger. No one's wearing a mask. These folks are in close contact. And so, I mean, as health professionals, we work so hard to prevent illness and to save people. So to see events like this is really a slap in the face.
And Nurse Alice, we talked about the president's risk factors yesterday, namely his age, his weight, his certain behaviors. Given that he is considered to be high risk, we know that this next week is going to be extremely critical. Can you talk to us some more about why that is and what his doctors are going to be looking for?
Right. So the president just began to present with symptoms. So he's just getting started on his illness course. So he's hospitalized, which is good. So now he's going to have around the clock surveillance with health professionals who can intervene immediately if needed. But some of the things that we're going to be looking for is he having a higher fever that's uncontrolled by Tylenol? Is his cough getting more severe? Is he getting short of breath? Because those all might be signs that he could be developing a pneumonia, which is fairly common because COVID-19 likes to attack the lungs. He could also be developing secondary infections, which they'll be watching for. Neurological changes such as dizziness, confusion, even seizures, and as well as this disease makes someone prone to clots. So that means that he might be at higher risk for developing a DVT, pulmonary embolism, or even a stroke. We've seen studies that show these things. So, you know, we're just getting started. He's going to be monitored for several things, because this course is not the same for everyone. And we're still learning a lot about what this looks like in who, because it's very individualized. Because of his risk factors, his course may look very different from someone else's course.
Yeah, it is different for everyone. Nurse Alice, thank you so much for your insight. We have many more questions for you, so we're going to check back in with you in about 30 minutes. Thanks for joining us.
Thanks.
All right, 7:19 right now. Let's switch.